Right, looking at the urinary tract infections here in chapter 24, we see that the urinary tract infections are mainly divided into cystitis, which is going to be an infection of the bladder, pyelonephritis, which is the infection of the kidneys, and then urethritis, which is an infection of the urethra. So kind of the three main parts of the urinary tract. So the bladder infection, kidney infection, or the urethra. So looking at the signs and symptoms of a bladder infection, so pain in the pubic area, frequent urges to urinate, and pain during urination. Also, the urine can be cloudy or even have blood in it due to that infection. Now, if we look at the infection of the kidney, it's kind of the same thing that we had seen with cystitis. However, it is typically accompanied by back pain and a high fever. So those two additional symptoms can help differentiate between the kidney and the bladder infection. And these can result in permanent damage to the kidneys if not treated. All right, so some of the causative agents, E. coli is the most common. It causes about 80% of all the urinary tract infections. And this is because it can invade deeper tissues. It has flagella, so it can move. And because it can get into the deeper tissues, it is kind of hidden from antibiotics that are used to treat it. So they can kind of hide in those tissue layers. It is transmitted from the GI tract, where it is normally found, to the urinary system. So that's why it's important for females to wipe from front to back, is to prevent the E. coli from being exposed to the urinary tract. Also, catheters are a main issue or cause of infection. So your catheter-associated UTIs are the most commonly, again, caused by the E. coli, of course, and then the Staphylococcus and Enterococcus species that we see. Klebsiella is actually another one that is common. So, of course, again, using catheters, exposure to E. coli and Klebsiella are the main ones we're looking at. All right, so our kind of summary table here, I'm just kind of taking those E. coli. The virulence are those adhesins. So again, it can attach easily to cells, and that motility that lets it get deeper into tissues. And again, about 80 to 90% of UTIs are caused by that or the catheter associated. The Staphylococcus staphylococcus, again, usually treated by the same treatment here, nitrofurantoin. Again, smaller percentage of those UTIs. And then our Enterococcus, this is based on susceptibility. The treatment is based on susceptibility testing. So depending on which one is available and which one responds to the antibiotics, this is a serious threat that's categorized by the CDC. All right, so we have, again, all of these causative agents. Some of the things they have in common. Again, mode of transmission for all of them is opportunism. So again, antibiotics being used, lower immunity due to maybe another infection. So these can be secondary infections that we see, transfer from the urinary or from the GI tract, which is referred to as community acquired, or environment or GI tract from the catheter. Culture and diagnosis is about the same. Prevention is also the same. So good hygiene practices to prevent E. coli, especially, again, paying attention to those catheters and limiting their use. Another disease of the urinary tract is called leptospirosis. This is zoonosis, so again, transmitted or found associated with wild or domesticated animals. The phase that we see with it, so the pathogen appears in the blood and also the cerebral spinal fluid. So we talked about this earlier with our nervous system infections. Symptoms include high fever, chills, headache, muscle aches, eye infections like conjunctivitis, and vomiting. Then we move into the immune phase, or the immune phase has a more mild fever compared to the leptospirosis phase. And then also headache that can be due to meningitis that has been caused. We also can see this Wheels syndrome, which is where it invades the kidney. It can have hepatic or liver disease that leads to jaundice, decrease in iron that leads to anemia, and other neurological issues. So we get long-term disability or even death can result from this. And it is caused by a spirochete called Leptospira intericans. So this spirochete has a tight regular coils, so you can see them kind of this beryllium shaped here, which is kind of where the name spira comes from. Adhesins attached to help it to invade and penetrate the host. They're shed in the urine of infected animals and can survive for a long time. There is some treatment with penicillins and other antibiotics. So if we looked at this leptospirosis table again, Leptospira interrogans, it is transmitted by a vehicle, so contaminated soil or water. Those virulence factors include adhesins or invasive proteins. So preventing, can be prevented by avoiding those contaminated vehicles and then treated with antibiotics. Next, we have the urinary schistosomiasis. So this is the one we mentioned before this, caused by the helminths. Sorry. So this is one of those parasitic worms. So it becomes lodged in the blood vessels of the bladder. So some of the signs and symptoms. So in both males and females, we get itchiness of the area where that helminth has entered. Fevers, chills, diarrhea, and cough. Usually some urinary tract symptoms like we'd seen earlier will progress, and it can cause a chronic long-term infection. Some of the pathogenesis, so it is able to invade the skin. It attaches to the vascular endothelium, so again that inner lining of our blood vessels, and it has this antigenic cloaking behavior that helps it evade the immune system. And this is detected by looking for the eggs of the helminth, and there is a drug that is typically used to treat it called praziquantel or quintanil. So looking at our summary figure here, so we have the schistosoma. Again, it's one of the helminths, the only helminth that causes the urinary tract in both males and females. It is in contaminated water that the eggs you'd be exposed to the eggs, and then they could then lead to the infection and the growth of the adult worms. This again, antigenic cloaking that affects the immune system. It also induces a granuloma, so that clumping or clustering of cells where they create a mass. Again, the best prevention is avoiding, contaminated water. And then we do have the treatment that is available.